I'm Joe Chile. You can listen to me mornings on the Big Weck. Joining us today on the Big Weck's Buffalo on the Rise is Jonathan McDonald, who's the owner of BAM Acupuncture. Jonathan, nice to see you today.
Good to see you, Joe.
Jonathan, one of the last times that I saw you, I was recovering from a bike accident, and you gave me the medication that kind of helped my shoulder
right
as I was healing, which was a great thing, and I didn't use it all up because you only used a little, very small amount. So if somebody's in some sort of pain, they can talk to you. It's not just about acupuncture. There's other things you can talk them through, right?
Yeah. So at BAM, we are an integrative health clinic. So obviously we specialize in acupuncture, but we also blend in some modern integrative therapies that we incorporate into our treatments. And really what that lets us do is, at BAM, our goal is to provide holistic treatments to people that maybe are having trouble finding solutions with other places. So our typical patient really has gone through the gambit of specialists and things like that, and they're just not finding treatments that work for them. And that's the type of patients that we're able to help by combining those two therapies.
Does it bother you if somebody says, I went to BAM Acupuncture as last resort, but it really worked?
No, I'm quite used to that.
Really?
Being the last resort with the best results. As long as we get the best results, that's fine.
And do people ever think, is this some kind of ancient Oriental secret? Is it, like the hocus pocus type thing that people may think about? Because when you get so used to traditional medicine,
right.
then when you think of things, although I know a lot of people that do homeopathic things now, and try to do that, try to eat well, try to, their diet is important and not too many sugars, not refined things, flour and things like this. But what do you tell people, when they come in and they want to know what BAM Acupuncture is about, what do you think are the key words that are important to them?
The key words that are important
or
to
the
them?
key phrases, the things that you're trying to get out to them that you think that'll be important, the things that strike them the most.
Well, I think a lot of the people that come to us really have a sense of hopelessness. They've tried all these Western things, and unfortunately it is kind of like, well, this needle thing sounds a little hokey, but we'll give it a try. But really, I think, from the moment you interact with my clinic, it's very professional. You come in and it's a very clean medical setting. And I do get that sometimes. Sometimes I'll have patients come in, we'll sit down for the consult, I'll talk to them. At the end, they're like, boy, what a relief. I wasn't sure what to expect. I was thinking, there'd be like those little Chinese yin yang things all over the place, and you'd be over here with like gongs over me and stuff like this. But no, it is a very clinical setting, much like you would go to a doctor's office. I think the difference is, I will listen. I will sit down and I will take the time to really understand what's going on. And that's kind of the nature of what we do. I've seen patients that haven't gotten results at other places. So our patients tend to have long stories and they tend to be complicated. So yeah, I think that's really what sets us apart is we're professional. I know if I can help you, and I'm going to sit down and listen to your story.
Is neuropathy a big thing?
That is by far and away the number one reason that people call our clinic.
And describe for people that don't understand, what is neuropathy?
So peripheral neuropathy specifically is deterioration of the nerves in the extremities. Okay, so patients that have neuropathy, typically it starts out quite minor. You might notice like a little tingling or pins and needles sensation, but as the nerve deteriorates, symptoms get worse. There's a lot of different types of neuropathy. You can have like diabetic neuropathy, which stems from having diabetes. Spinal stenosis can cause neuropathy. Different autoimmune conditions can lead to neuropathy. So yeah, the bottom line is, though, it's deterioration of the nerves in the extremity, which starts to affect your ability to navigate the world. I'll give you an example. So I had a patient that we consulted recently. He's had neuropathy for 10 years. Okay. When it started out, he had just retired. He wanted to travel. So he didn't really think he needed to do much about it, and he could deal with it. It was waking him up at night once in a while with pins and needles. Eventually that progressed to burning. But he really didn't do anything to address it. So it's a progressive disease. So the kind of aha moment for him is he was on vacation with his wife and he was starting to lose sensation in his feet. His foot slipped off the brake pedal And with the rental car, he smashed into another rental car, right? And that's when he realized, like, wow, this isn't something that I can just deal with on my own anymore.
You know,
So,
is there a point, you know, you bring up a good, interesting fact there. Is there a point that people might not feel the ground beneath their feet?
oh yeah. I mean, and you know, unfortunately, once it gets to that place of numbness, you know, these people in that situation often have been dealing with pain for a long time. You know, and then all of a sudden that pain starts to go away and you can't feel your legs. And, you know, to you and I, that sounds like a good thing. Oh, no more pain, you can't feel your feet. But that's not a good situation at all. You know, that's often the straw that breaks the camel's back that leads people to us, because they realize, like, my balance is affected. I can't drive anymore. That's really when you're not only dealing with pain, but now you're having a loss of independence. You know, you're depending on other people. You can't enjoy your life. You know?
So it's better for people to come to you sooner rather than later.
Absolutely.
You know, it gets to the point of no return, right? I mean, if you've got numbness or tingling or something like that, they should come and see you. And if anybody's curious, what should they do?
Just call us. You know, if you want to find more information, you can go to our website. We have a lot of testimonials, patients that have gone through treatment. You know, we'll describe to other patients what it's like. If you visit bamacupuncture.com, you'll get a lot of information there. But it's super easy to get started. You know, if you just call our office, you'll get in touch with a patient care coordinator. They'll get you set up with a consultation with me. You and I will sit down and we'll do a little investigative work, see exactly what's going on. I'll spell out a very clear treatment plan for you, and then we can get you going, usually that day.
This is the guy that you see.
That's right.
All right, Jonathan, thank you. For more information and answers to your questions, contact BAM Acupuncture by calling 716-333-4BAM or go to bamacupuncture.com. Sponsorship and promotional considerations for the preceding segment was provided by the following.